Hi everyone, Dr. Suneel Dhand, medical doctor. Welcome to another video. Those of you who watch my videos know my own views on the utter shambles that our healthcare system is in lots of different countries, not simply the United States and the United Kingdom. Healthcare systems are falling apart absolutely everywhere with similar complaints and issues. And I'm going to tell you something, not just as a doctor, I want to talk now as a human being and tell you that I do everything possible to avoid healthcare interactions. That may seem strange for a doctor to say, but honestly, I do everything possible to avoid healthcare interactions, particularly in the United States, the country that I'm in. I do not trust the system. I do not want to be plugged into the system, and I think large segments of the system are a complete and utter scam to make money. So I do my best to stay well away from any healthcare interaction whatsoever, unless I absolutely need it. And I can tell you this, I've had great insurance for many years, and technically everybody is supposed to register with a primary care doctor and have yearly physicals. It's all covered, it would all be free. Yearly lab work, etc., visiting the doctor, going over things, but I've got zero interest in doing that. I don't even use those benefits, I never have. And I accept that I've got unique knowledge as a physician. Everybody is not in the position I am in, and everybody should know when they should seek help. But I'm talking now as a human being. I genuinely don't want any interaction with our healthcare system. We absolutely suck at chronic diseases, at prevention, etc., taking care of patients as a whole. We don't do that. One thing we are good at, however, is fixing acute emergencies quickly, and I'm proud to be a part of that in my hospital work. Of course, if anyone has an emergency, they need help. If they have a broken bone, if they have an accident, if they have overwhelming sepsis, infection, heart failure, strokes, etc., of course you need to seek medical attention. But everything else in terms of chronic, ongoing outpatient management is really something that we have to ask a lot of questions about, because we do an absolutely terrible job. Now, in the interest of full disclosure, when it comes to primary care, a lot of my best friends are primary care doctors, GPs, internists, family practice doctors. They're good people, but they know themselves that they work in an absolutely terrible system. They are stuck in a horrible system. And that is what happens when an entire profession, the medical profession, sells itself out to big business and big government. So in many ways, the medical profession is getting exactly what it deserves. And I feel especially sorry in the United States when I see these new graduates, hundreds of thousands of dollars in debt. They are crushed in debt. They're basically in a state of servitude. They're not going to stand up to the system or ask questions of authorities. They will simply put their heads down because they are crushed in debt and need to do their job. So it's really an awful situation all around. But let me tell you what I think would happen if Suneel Dhand, not Dr. Suneel Dhand, if I as a human finally decided that yes, I want to use my healthcare benefits, I'll have a yearly physical, I'll go to a routine primary care doctor. Here is what I think would happen. Firstly, it's almost impossible in many parts of the country to even find a primary care doctor. So assuming I found one, it might take a long time to get an appointment. I would go there, that doctor would look very stressed. Again, no fault of the doctor, they are overwhelmed with bureaucracy. That doctor, for the same reasons, would be glued to their computer screen. They would keep turning around, clicking boxes, asking me in a robotic way all of the questions, barely making eye contact with me. Going through everything, what we call cookbook medicine, protocol following. Have you done this, Suneel? Have you done that? Have you had this test done? Have you had this injection? Tick, tick, cross, cross, etc., etc. That's it. Why would I want to go and have a healthcare interaction like that? I have no interest whatsoever. And then there's some doctors out there who are simply just drug pushers and their clinics are pill mills. What can I prescribe you next? What prescription do you need? Without ever talking about root causes. Whatever happened to how a medical consultation should be? How a medical professional should be able to sit down with their patient? In an ideal system, sit down, look at the patient, make eye contact. You are the center of my world during this time that I get to talk to you. Tell me about yourself. Tell me, what are your symptoms? What are your concerns? Are you stressed right now? Are you sleeping enough? What are you eating? What are you putting into your body? Let's have a holistic discussion about your health, not simply going through mindless tick boxes. A lot of this as well is the fault of medical education. teaching doctors to become mindless robotic protocol followers. There's never any personalized medicine. There's never any critical thinking. So that is why I do everything possible to stay away from these nonsense, routine medical interactions. I have no interest whatsoever. Let me tell you then, in the interest of full disclosure, what I do. And again, I accept that I'm a doctor with unique medical knowledge. Every so often, I'll get some routine lab tests done. I'll go over those. And I know other people as well, actually even who aren't healthcare trained, who go outside the system, get their own tests done. And of course, I'm aware, and I would encourage everyone to be aware of those red flag signs when you do need help. Hopefully everybody is aware of these. If you suddenly feel more tired than usual, if you have any unusual pains that you've never had before, if any bodily systems start working differently to how they did before, if you're having any unusual weight loss, that's a big one. If you feel mentally like anything is unusual, you're having more confusion, etc., that applies especially to older people. But all of these red flag signs are when you do need help, because there are things out there for which the medical system is very good, but for way too many things it is terrible, and we don't take adequate care of our patients. And I'll say once again, that is what happens when an entire profession sells itself out to corporate interests and big government. So the medical profession is getting what it deserves, but unfortunately it is the patients that suffer, and that is the tragedy. So as far as my own health goals, I do everything possible, and I would encourage everyone else out there to make the right health decisions every day. And as far as I'm concerned, my main goal is to do everything possible to stay away from the medical industrial complex. Thanks everyone for listening. Let me know your thoughts down below. Check out my online course and my Uncensored platform. Those links are down below as well. Have a great long weekend, everyone. It's July the 4th. Hit the like button if you like this video and the bell button for more similar videos in the future. We will talk again very soon.